So, although it is public health is not my training, obviously being a pediatrician and physician, public health is a major part of what my responsibility is. So, with the motivation that Dr. McCary and Secretary Kennedy provided, I turned my attention to looking at the safety of food additives. In particular, I started a systemic review of a list of compounds, chemicals that FDA back in the 70s determined was quote unquote generally regarded as safe or GRAS. So in the 70s, the FDA undertook a systematic evaluation using panels of experts to determine if certain chemicals that were already in our food supply or those that food manufacturers wanted to add to our food supply could be determined to be safe. And they did so. However, after making those determinations in the 70s and early 80s, no one re-examined the safety of that list of GRAS, or generally regarded as safe substances. And you can imagine from the early 80s until now, how data and experience has evolved. And unfortunately, until this administration brought it to our attention that, gee, maybe there's new data, we ought to reevaluate the safety of these additives, did we begin to evaluate. So I undertook a very thorough and systematic review. There will be more to come.